Welcome to ABA on Tap, where our goal is to find the best recipe to brew the smoothest, coldest, and best tasting ABA around. I'm Dan Lowry with Mike Rubio, and join us on our journey as we look back into the ingredients to form the best concoction of ABA on tap. In this podcast, we will talk about the history of the ABA brew, how much to consume to achieve the optimum buzz while not getting too drunk, and the recommended pairings to bring to the table. So without further ado, sit back, relax, and always analyze responsibly.
All right. Welcome back to another installment of ABA on Tap. I am your ever grateful co-host, Mike Rubio, and welcome back to part 2 with Rachel Benson as we discuss behavior and sexuality. Enjoy.
Yeah, so if we are working towards dating or anything partnered sexually, I always make sure guardian's on board, because otherwise we're not going to introduce it, because that's a bummer to be like, hey, here's all these skills and you don't ever get to use them. Won't get a lot of buy-in from the client with that. So have to get guardian approval, and sometimes they say no, and then we shift our focus to navigating those skills. We use ACT a lot, acceptance and commitment therapy.
Sure.
So we work with that a lot on, navigating those things that aren't lining up with what we want for our life. They are, I said earlier, where the values are between the client and the guardian sometimes do not match up. So being able to help them navigate when that's the case. I've also had times where my client has gotten permission to date, have sex, this, that, and the other, but the person they want to do it with, their guardian has said no.
That's kind of what I was asking more so. How do they, let's say your client, maybe they're not conserved, maybe they have, independence over all of their decision making and outcomes. How do you educate them on first determining whether the person that they're speaking to is conserved? Because that would be a real weird question to ask some random person on the street. Maybe it isn't. And kind of avoiding situations where they're going to get themselves caught up in a sticky situation. Because the person they're engaging with may not be able to give consent.
Yeah, the only time I've seen that happen is when it's someone from like their day program or voc rehab, to where the population that they're mostly around also is in the system or has a disability or something like that. I will be honest, I haven't really tackled that with my clients that are not in that, are not trying to date in that world as much, because it is kind of different to be like, hey, do you have a court guardian?
Yeah.
Maybe like, well, why are you asking?
Yeah.
But typically the one client I had where the other individual was not allowed to, she had met him at their job, at their voc rehab. They wanted to date each other. They were allowed to go on dates. And then she expressed that they both said they wanted to have sex. So her case manager contacted the other case manager, and then it kind of went downhill from there. So that was a hard one. She had done a lot of work to get those rights back, and that was a sad one to have to help her navigate that. And he wanted it too, and just the guardian wasn't on board.
That's got to be tricky. It's almost like selling yourself to the guardian, right? Like I'm hypothesizing, right? Like why is this person is it more selling the partner to the guardian, or is it more like selling that the person that they have guardianship over has enough wherewithal to make that decision and to trust that person's judgment?
So it's a little bit of both.
Okay.
A lot of times guardians, they take their job very seriously.
Sure.
They take it as they're trying to keep this person safe, or keep the community safe, or a combination of both. So that sometimes manifests itself as, well, they're not going to be allowed to have sex or date because I just don't think they can. So we're just going to say no.
Yeah.
And I try to be like, That's what I'm here for. I will gladly take this client on, and then I can work with them together to make sure I'm not just hearing one side of the story of this person says that they both want to get it on. And then I talk to this one and he's like, no, I don't even know who she is. Right? Like, it's great to be able to work with both clients and make sure that they're both able to consent and have that capacity. And then you kind of hear stories and see if that generalizing is happening outside of session too. But
Sure.
that's unfortunately rarer than more common to be able to have both individuals coming in for services.
That seems like it's sort of a frustrating hit or miss. You're doing your best to acknowledge somebody's desires and their autonomy and so on and so forth. And you must be finding common barriers. So I imagine sort of religiosity or religious background is probably something that, have you found anything that is helpful in trying to, and again, I'm pretty sure it's a coin toss and that have probably carried a certain amount of frustration. But when you're able to get that victory for all where everybody feels comfortable, is there anything at all that you found is your trick? The one thing that, say, for a very religious family might make them reconsider?
We talk about values a lot. So going back to some of that ACT work and talking about values, because pretty much everybody is going to have the same value of safety. I want the client to be safe. The client usually wants to be safe. The parents, the guardian, the caregivers want the client to be safe. So that's a really good starting point, and then we can build from there. A lot of times also just time. I'm coming into, I mean, you guys have done assessments. You're coming in to do an assessment on someone. You barely know anybody involved. And then I'm coming in talking about something that no one wants to talk about. And it's uncomfortable. So time itself is really helpful. I have found just in my area of the field, because especially when people see the assessment and they're like, oh my gosh, you're talking about, you want to teach them about STIs and birth control. Like, they're not even following consent. Well, we're not doing that all on day one, right? Like, that is so far down the line. It's just here. So you see the vision, you see the whole vision, the whole future, what we want to do, but we're starting with basics. So that tends to make people relax a little bit too, because they, like I said, they see the assessment. They don't know me. They maybe talked to me for a few hours tops, and it's all about uncomfortable things. So having the trust built up tends to help a lot. Like I said, values is always really helpful too. I will say the only times I've had people really fight, it's usually in the assessment phase. So if they're gonna disagree, it's usually gonna be early on in the process.
That's tricky too, because like a conservator isn't necessarily going to have the same values as the person that they're having conservatorship over.
Yep.
And there's levels of conservatorship too.
Sure.
Do they all cover that level of consent? I don't know you're probably privy to that. They all pretty much, in terms of engaging in sexual relations with somebody else.
I mean, there's some that will be like, I have other clients said they can date and have sex, but I don't. I think it's probably because they haven't had any challenging behaviors. So then it seems like they can handle it a little better, air quotes on that. But again, I don't know how much education's happening there, because I don't see those ones.
When you hit a hard stop and it's just a no, what's the recourse there? You were talking about how hard it is to maybe explain that to a client, but when we're talking about something as basic as a FERB, as an equivalent replacement behavior, I mean, what are you recommending? Continued, was it the solo sex you're talking about? I mean, where does that go? That's really difficult, because in terms of autonomy, that's just an immovable barricade, right? You've got no consent to be able to do that. Yeah, where do people go? That seems a really impossible situation.
I try to find out why it's being denied. If there's something legitimate, like the guardian's like, hey, I just don't think they have enough education or practice yet. Like, can it just be a no for now?
You can
Sure.
remedy that.
Let's work on some more. I'll come up with more ideas. I primarily do telehealth, but in cases like that, I might go out with them in the community, see what's going on. So kind of just a little bit more education. Sometimes all that's needed. If it seems like it's just a hard stop and I can't get a reason why and they won't entertain the idea, there have been times then you escalate it to like a review board or if there's someone higher than the court guardian, because then it does start to get in the realm of, are you taking away basic human rights?
So there's a lot of liability in what you do, right? So if you're working with somebody who
Yeah.
does commit a sex crime or something and then says, well, Rachel told me I could do that, totally misunderstanding or misconstruing what you said, or
No balance.
even just a clientele of your company gets arrested, is there like liability that you're constantly having to navigate, or is it kind of like a general understanding that you very well know what you're doing and you're going to give good information, and if something doesn't come productive of that, they either misconstrued the information or went outside of the information given?
I mean, there's always a realm of liability on us because they're bringing us in. We're supposed to be an expert at this. And we create crisis plans, especially if it is based off of behaviors that are illegal or could easily fall into an illegal status or harassment or something along those lines. We create crisis plans, make sure staff are trained on those. And then also just acknowledging, like, I can't guarantee anything. So there is a level of like unknown to a lot of things, but I can't guarantee that you're not gonna go out and commit a sex crime, right? I can't there no matter who it is, there's those levels of risk. But that's when we try to, show the data and the graphs and all the things saying, hey, here's all the things they're saying they know in session with me. Here's all the things that your staff is saying they've generalized to outside of session. We kind of just have to let them try.
And so when it comes to the data, it sounds like your company has a really good success rate. Do you want to speak to that at all? Do you have any like figures or facts or anything that can speak to kind of, because I imagine if the states come to you, y'all do some wonderful work. They don't just throw money around.
Yeah, I don't have any stats off the top of my head on like how many people have come in or gone out or this. I mean, we have a really good relationship with the DMH system and pretty much we're one of the only places in Missouri that do the work that we do. And we're the only one that does it full time. So we get a lot of their cases. I mean, we overall do have a lot of success just with, like I said, just the basics. It's funny how much that's really what's needed is just the basic education on things, public and private, age discrimination, things like that are so common in the clients that we see. Like I said, they've just never been taught.
That's got to be so like reinforcing to like destigmatize that, whether it's the mental health community or people who have either not been comfortable enough to initiate that or have done it the wrong way and gotten punishment for it. Like to be able to help people live more fulfilling lives, even in just that special little niche. That's got to be so motivating I'm sure you get some anecdotal success stories of people coming back and being like, yeah, this actually went really well. I had my first girlfriend or boyfriend or whatever it is.
Yeah. Yeah, there's a client now that I discharged a couple months ago and just got an email this past week, and he's like, just wanted to let you know this, like, I've been doing really good. And it is great to hear those things. And we sometimes have different, myself or different colleagues work with individuals in the same home. Sometimes it's just the way caseloads pan out.
Okay.
So sometimes hearing someone else being like, oh yeah, this person's really been doing really well, or them together has gotten so much better, and hearing stuff like that is really good. And anytime we can get people some knowledge and, like I said, just some basic rights or get their rights back, is always a win.
So speaking of stats, I've heard a stat. First of all, when I give it, please correct me if I'm wrong, because you're gonna know way more. And then I'm not really gonna ask anything besides just give me your thoughts on anything you want to speak to it. So I've heard that up to I think it was 80% of individuals with special needs or developmental disabilities get physically or sexually assaulted, and I think a lot of that is sexual assault. Um, Number one, is that an accurate stat? And number two, thoughts on that?
Yeah, it's really high. Thoughts on that? Uh,
Thoughts on
so
that
many.
in terms of maybe why, how to prevent, like anything specific that you want to share with your level of expertise on that stat, because that's a really unfortunate
I
stat.
guess the idea of privacy comes in, and we've sort of alluded to it, but I
Sure.
don't know that we've actually used that word. Consent's super important. Yeah, how does that play in there?
Yeah.
Yeah, I mean, you guys earlier, talked about assent,
Yeah.
and that's kind of been a big buzzword in the ABA community in the past 5-ish years or
Or
less.
so.
Same with consent, but kind of changing how we program, I think, is huge, especially when we're looking at early intervention and people want to target noncompliance. But then they don't discriminate when noncompliance should happen,
Yeah.
right? If someone's touching you and you don't like it, are you supposed to just sit there and say, okay,
Mm.
because you've been taught that you can't say no?
The word no
Or
gets
you've been,
devalued so early. Yep.
yeah, or people doing physical prompting and an individual is uncomfortable and they have these uncomfortable feelings in their body about it, but they know they have to just do it because that's what their RBT does or whoever, their teacher, or whoever, sometimes even a parent, they're physically prompting somebody through, and it doesn't matter if they're saying, I don't like this, I'm uncomfortable. So then again, okay, when someone's touching me in an inappropriate way, I'm feeling uncomfortable. I've been told I can't say no, and I've been told I just have to deal with that. It's inadvertently those skills are setting up prime situations for some kind of assault, whether it's physical, sexual, anything along those lines. So really kind of taking a look at how things are being taught and
Okay.
changing that, even if it can be difficult when we're working with clients and all they say is no, but recognizing that no should be powerful. Like you said, we shouldn't devalue it. The no is a complete sentence. The no should be powerful. Um, we should be able to find a different way to teach if that way is not working.
I want to switch gears here as we suspected this would be an easy conversation, and it has been so. So, in the interest of time, I want to switch gears to another topic. But before we do, you were talking about limit setting, and I'm going to ask you a very broad question. But if there's any guidelines that you would lend somebody, if we're talking about masturbation and the idea of you're going to allow a time and space, are there any given parameters you use to tell a family, hey, this is too much, this is enough? I know there's probably individual factors in there, but what would you say to that? And then what would you say to the same question now, but regarding porn consumption?
Yeah, so with solo sex, there's a couple of factors, especially if we're looking at disability population. Sometimes if you're seeing high rates of solo sex, it might be ineffective. So a question I have to ask a lot is, do you see any inklings that it is successful? Are they telling you it's successful? Are you seeing stuff on a towel? It's a little bit easier with someone with a penis to tell if it's successful than someone with a vulva. So asking those questions, because often find that it's ineffective. So then when you have someone's like, oh my gosh, they literally are in their room 10 hours a day and we've come in and knocked and that's all they're doing. Well, they might be struggling. So then you would address how to fix that. What's ineffective? What needs to be done? Is it grip strength? Is it stamina? Whatever it may be. And then if it's, then you have to look at medical side too. Are they now causing chafing? Are they getting sores? Something along those lines. Want to address that if it's been a long amount of time. Sometimes it depends on the age, and maybe we fix the ineffective solo sex. Well, then we might see a real
And
big
that takes care of
increase
it, right? But
because now it's doing what it's supposed to do, and it feels better than before. So we're just gonna do that all the time.
and you probably have to allow for that for a little bit. You have to kind of watch for it
Absolutely.
to settle into a different pattern. Yeah, wow, that's fascinating. So with regard to say porn consumption, how would you speak to that in terms of limit setting?
Yeah, so that gets hard, and same with the solo sex in terms of what's just a God-given right to
Hmm.
be able to do. But also you have to live your life, right? Like I have to go to work, I have to eat and shower and do my chores. I can't watch porn or have sex all day long. That's how I explain it to clients all the time. Like regular people without it, because then they'll blame the guardian or the caregiver. No, regular people just can't do this either. Right? You still have to live life. You still have to do things. So I try to have that conversation before we get into any hard boundaries of how long. Obviously, you can't. It still needs to
Cool.
be in
Yeah.
your room or the bathroom, door closed, all of those things. So we already have some of those boundaries built in of not at school, not at work, not at grandma's house, needs to be here. So then what sometimes we'll do is I'll try to have a little bit of satiation of, hey, you're going to work in 2 hours. You need to go take your time.
Mm,
Go take your time.
mm.
And then you can go to work. And then maybe when you come home, you take some time and then you eat dinner or, work with the schedule a little bit. Or if they're, watching pornography again, are you still doing what you need to do just to live your general life? Or do we need to have some conversations about that?
All right. Okay. So, Mr. Dan, I want to jump into a discussion about, I guess, sexuality as a behavior as it relates to gender.
That's what I was going to ask
Oh,
about next. Sexual identity, right?
so if I'm not even sure how to phrase the question, maybe you can just start with a simple distinction and definition, as well as all the middle ground. When people say sex and gender, give us. I know that's a huge question. Give us
Yeah.
your best sort of functional definition of those two things for the rest of our discussion. Just because I think there's a lot of ground to cover there.
Yeah, so I think with sex, there's kind of two different routes. A lot of people say sex and they mean a sexual act.
Mm.
And then there's also sex as in like your biological sex. What are your chromosomes? What do your chromosomes say? Because we don't want to forget about our intersex folks. It's not always what kind of genitals you have, it's also what chromosomes you have. Um, and then in terms of gender, that gets a little bit more tricky because
Yeah.
there's some people who base gender off of your genitals, and other people base gender off of what is your identity? What do you feel your gender is? And and then you with that definition, you encompass a little bit more of the intersex community, the trans community, the non-binary community. So it kind of depends on
Perfect.
sadly people's own values on how they're going to look at some of this, and then you throw in, you can throw in gender norms and all that stuff. It gets deep real quick.
Again, your factor analyses. I want to see your whiteboard in your office or whatever you use you look like a detective, right? So with all the yarn string connected between things.
Yeah.
I mean, I can only imagine because it's so variable when you're talking about values and then interrelational or interpersonal relationships, knowing that these are, we've been talking about uncomfortable topics. This can be a very uncomfortable topic for people who
hmm
can't relate, don't otherwise want to understand something like transgenderism. How does that work out behaviorally for those individuals? You're asking, I mean, presumably you're asking them to think about their expression of their own identity in a way that's free, and then I guess to some degree you're also having to inform them as to how that might be received or worse, not received. That's a lot. That's a lot. Explain to us a little bit about how you
Yeah.
might engage that
Yeah.
particular circumstance.
So obviously we start with affirming. So like when we're doing telehealth, you can see I have my pronouns by my name.
Mm,
I show my clients how they can change their name and their pronouns on Zoom so that sometimes depending on the day, they might have different feelings and they don't always like to be asked every time we meet. It can be annoying, so I just show them how to change their own name and pronouns, and then I know where to go from there. That's a really good, easy step that I do.
nice.
Um, we have a really cool program called Queer Culture, and it's surrounding a lot of different euphemisms that are used, or code words, or even like who are some activists and people you can look up to in specific communities that they might identify in, and
Can you define
we
what
talk
queer
about
culture is, Rachel? That word and maybe the
yeah.
culture around it?
Yeah, so the queer community has a very vibrant and unique culture. So there's different phrases that might be used um, in the communities that people might not know. So if someone's identifying as a gay man, they should know what a daddy is, what a twink is, things like
Mm,
that. Because if they go out in the community and they hear those things, if they don't know what it means, they could get made fun of. They could just, feel uncomfortable, feel inferior, things like that. So again, my job is to give you the tools. Sometimes that includes different language that might be used.
So is queer the larger umbrella, and then within that you
Hmm.
have the gay community, the lesbian community, transgender community, things like that. Please correct
Yeah.
me if I'm wrong. Queer is
Yeah.
so like the larger. So maybe you've got the prototypical heterosexual community, and then outside of that, the majority of that is queer community, and then it falls within different facets of that. Is that
Yeah.
correct? Okay.
Hmm.
Thank
okay.
you for clarifying that.
Yeah, of course.
No, I love the example you give with, and again, that's the expression of say, hey, and further even saying it might change from day to day, but I'm telling you how to address me, and even that is going to be might be difficult for other people. So you have to prepare your clients for that. Is that as simple as you're withdrawing from them, or what are the parameters around that? Because again, that's sort of part of an aversive stimulus that you're hoping they can shape into some other response, but that's largely out of a lot of our control a lot of time. That's difficult, and again,
Hmm.
I'm thank you for all the information you're lending us. These are questions that I think we've been interested in asking for a long time. So we appreciate your content expertise, but that's got to be difficult. Again, you're hitting some cultural or social norms sometimes, almost face first, and places where you're not going to get acceptance. Just to say that.
Yeah. So that's definitely a big one. We work on self-advocacy,
Mm,
and saying like, no, I prefer to go by she, her, or my preferred name is Rachel, right? Some self-advocacy in
cool. Cool.
politely and, correcting somebody. And then, okay, what if this individual continually does it, or it seems they're doing it on purpose? Well, then you do have permission to step back from that relationship. You don't
Mm,
have to keep people in your life, especially again in communities where someone maybe has grown up in the system and they've been in different foster houses or residential and now they're in group homes. A lot of times they don't choose their relationships. Their relationships are kind of chosen for them. Their staff comes
mm,
and goes for them.
sure.
Their guardians might change. Their
Wow.
case managers might change. BCBAs might change, right? So they might not understand that they have a choice on who's in their life as
Mm,
well. So just giving that permission of you don't have to have them in. It's okay. Um, Also some acceptance and knowledge of some if it's applicable or going to be understandable of social climate, political climate, unfortunately, of
yeah.
that. And I've had a couple clients where we've created safety plans for them with certain laws that are changing and where they might live if they can't move out of a more conservative area, but they identify in the queer community. We've created safety plans. What if someone does come to you on the street and starts doing something? What do you do? And it's sad and it breaks my heart that that's a thing that has to happen, but it's going to give them some extra tools.
We talk about masking a whole lot, and
I
this
was
is a whole
literally just getting
different
into
level
Yeah.
of that. I mean, that's just really an unfortunate. Well, I don't know that we talk about it negatively with good reason, and this is a whole different aspect of that. What? So there's sort of a pop culture question, and you might have particular insight to this behaviorally or otherwise, but there seems to be a high correlation between transgender individuals and neurodiverse individuals. Can you speak to that just, sort of in a general way? Because I know that's a question that a lot of people ponder. And again, you might be in an interesting position to give insight to that.
Yeah, I think that some of that could be from potential lack of, it- what's the word? I don't want to say not caring, but neurodivergent individuals might not place as much of a value
Value.
on social norms as neurotypicals do. So who cares if someone doesn't like that I'm wearing a dress or I cut my hair short or I paint my nails or whatever it may be. So then there's a little bit more freedom of expression and freedom of acceptance in their individuality versus trying to not to be that way or judge or mask for,
Yeah.
better words in the neurotypical community because, you have a little bit more put on those social norms.
Wow, that's a fantastic, very succinct answer. I mean, in order to buy into an image ideal, you have to care
Yep.
Yeah.
about the social norm. Otherwise, I don't care, and I'm not really buying into how this might otherwise attract or repel this or that potential mate. I mean, it gets so layered that you cut right through that. That's an excellent, succinct answer. I appreciate that, Mr. Dan. What have you
No,
got
you,
for
you
us?
brought up masking. That was going to be my next thought. Is I'm sure, especially in the just neurotypical queer community, you have at least a portion, if not a large portion, that at some point in their life maybe go through a level of masking where they are feeling pressure. Yeah, in the closet, I guess would be kind of a pop term or probably a bastardized term. So there's a level of masking there, and then you add on the neurodivergent piece, and there's that additional level of masking. Can you speak to, is that something that you deal with a lot? Is masking either from just being able to come out or people feeling like they're not able to express themselves?
Oh, absolutely. And I do on the more like private neurotypical-ish side that I do a lot with individuals in the kink community. So there's a lot with having to mask certain you have your like kink persona and then sometimes your professional facing persona. And there's a lot of misinformation and judgment on people in the kink community. So a lot of times people don't want anyone else to know that might be where they hang out or their identities. So it's a different type of masking, but coming to terms with that when someone's like, well, I want someone to be able to know the whole me or know who I am, and I don't want to have to hide these things, but for safety, they might have to. So working through that, and we talk a lot about um, some acceptance
Sure.
that some of this we just can't change. I can't change society in accepting that. Looking at our relationships, who are we surrounding ourselves with people who are, even if they don't identify the same way I do, are they supportive of who I am? And taking a real good look at those things, stuff like that.
Interesting. So, do you have any like general recommendations for maybe listeners that either they themselves are feeling this pressure to mask, or parents of children that might be masking unbeknownst to the parents um, because of the pressure that they feel from them? Do you have any kind of general ways of bringing that out, whether it's just discussing, sitting down and having discussions with your child, or like any general rules of thumbs or suggestions to help people get past this masking?
Having a safe place to be who they are. Think of, again, thankfully in the last couple years, we've gotten a little bit away in the field of targeting like stimming behavior. If you want to stim, go ahead and stim. It serves a purpose. A lot of times it helps calm the nervous system, gets things out, gives the input. So having a safe place to be who this person wants to be, regardless of who it is.
That's tricky in society because there are a lot of, especially in potentially less liberal areas, a lot of like preconceived notions of what everyone's supposed to be and how everyone's supposed to act. And if you don't fall within that, there's a lot of judgments, potentially less opportunities and things like that. So that's it. I guess that is also potentially one good thing about the internet is there are places where people can have safe spaces and find people that have common beliefs and ideas as themselves and express themselves, even if their current physical community doesn't allow for that.
Yeah, finding a community to be involved in, support groups. I never, as much as moving somewhere new is always the great answer, it's not a realistic answer. So that's typically not one that's always a first option. But yeah, joining communities, chat spaces. A lot of schools will have, if they're in school settings, they'll have student groups, just having that be an option instead of being like, no one can know, it's secret, it's hidden, just put it in the box and you can only open the box right now. But, having it be just unwavering support.
Which is probably hard to get, but at least if you can have your social circle and support group, you'll get it in that aspect of your life, right?
Mm-hmm. Yeah.
Hopefully I can phrase this question effectively, but we've, without saying the words, we've sort of alluded to some aspects of what people would say is, dysphoria or disorder. But if we start thinking about the general premises you're talking about, they're not uncommon in the general population. It's just somebody knowing how to inhibit better than somebody else in terms of social norms. If there was something that you wanted to educate the general public on this, because people can get so caught up on the notion of, say, gender dysphoria, and now you're using this clinical term, and now something is wrong with that person based on their behavior. Obviously, we have a different mindset here as we explore these things. If there was, phrasing or general education you would want to give to the general public on that level of confusion, what might that be?
Ooh,
I know it's a big one, but again, I think you've told us so much. I'd be very interested in seeing sort of your insight on this very large question.
Just remember, people are human. I don't think anybody would choose to hate the body they're in. I don't think anybody would choose to put themselves out into a world that is potentially not welcoming and unsafe. It's who they are. And so just remember that people are human and have human experiences, and just to be it sounds so simple and like
That's
silly,
great.
but just being a good person to other people.
And it's moment to moment in what you're describing too, especially with these things. And again, it could be very confusing to a general public who doesn't care to try to understand it. And I'm not making any claim that I think I fully understand. I think it's an active curiosity, asking questions of people that are more informed. But I think I wanted to, and sort of emphasize your point there, that it's a moment to moment in terms of how somebody identifies themselves. And, why do we get so stuck on whether or not it aligns with our more general notion?
It goes to that difference between the golden rule and the platinum rule, right? Instead of treating people how you would like to be treated, treat them how you think they would like to be treated. I think so often we think we treat them how we would want to be treated, but that's now assuming like a lack of cultural humility, right? Because we're now assuming our culture, if we're talking about the sex culture or whatever kink culture, whatever culture you're talking about, is the correct culture.
So much to cover there. Go ahead, Dan.
So I wanted to circle all the way back to something you said earlier, but before I do that, did you have any questions before?
Good. Thank you.
So you mentioned that you were kind of unfulfilled in the general ABA day-to-day BCBA life. So you were thinking about getting out of the field, but you found this niche within sexuality that it seemed to really inspire you, and you've obviously gotten multiple credentials now. Can you talk about what this specific niche has fulfilled that the general practice of ABA didn't for you?
Oh, yeah. Okay, so it's a hard and easy answer all at once. Where I was at prior, I feel like it was getting monotonous. There was a lot of the same early intervention, manding, tacting stuff. And now there's more variety, which is great. And I feel like I'm helping in an area that very often gets overlooked, and I'm able to help people get their voice and to advocate for themselves, whether that's as simple as don't touch me, leave me alone, or I want to date this person, or this is who I am, and this is how I identify. I've always wanted to feel like I'm making an impact and a difference in the world, in like a self-centered way, but just
Sure.
wanting to leave the world better than when I came into it. And I feel like I'm able to do that now.
Seems like maybe like with ABA, the general practice, almost like a general doctor, right? You're not going to have a general doctor do surgery. You're going to have something more specialized. And what you made me think about when you were saying that is like maybe we're jack of all trades, masters of none. Like there's so much we have to do. We have to teach play, we have to teach communication and feeding and eating and sleep. Well, feeding and eating, I guess, are the same thing. And sleeping and maybe sexuality and social skills and like all of these things where it's like we're not really able to fully delve into one of them because there's 50 different targets of 6 different domains that we're trying to work on at once. And it sounds like maybe when you are able to focus on that one domain, it just really spoke to you and you were able to really see improvements because that was like your focus and your niche at that time.
Yeah.
You reminisced about the manding and the sort of earlier intervention and younger groups, and we don't necessarily think about those age groups of sexuality. Although I'm sure you've encountered those cases. I know I do. Boys thrusting or rubbing against the floor. The idea that speaking to parents about the notion that the reproductive piece isn't quite there, but the rest of it's fully active. And I don't know if you want to speak to that a little bit, if you had any experience during your big box operation days where that might have inspired you into your current work. What's your notion on early childhood and the expression of sexuality?
Yeah, that definitely saw some stuff with, like you were saying, like rubbing against floors, furniture, things like that. And just reminding again that the sexuality piece really isn't there. It's more of a self-soothing factor. And while, sometimes that's a little bit easier to replace, it also isn't at the same time because your body parts are attached. You bring them everywhere, right? There's usually something to rub up against. So it can be a little bit harder to replace, but then you teach some of those other skills of public and private, and you can really set up for a lot of positive things by not shaming, not guilting at a really young age, just for acknowledging that those things feel good. And it's serving a purpose for them. And that can also lead to, okay, if they're doing this all the time as a 3-year-old, a 4-year-old, something's dysregulated. It's this, it'd be the same as using any other coping skill 24/7. Something's dysregulated. Maybe we need to look at the bigger picture of what's going on. And even people forget how much of these skills can be taught with toileting. How much is somebody hands-on with toileting with a young learner? Or someone older that might be toileting at an older age, but is someone in the bathroom, or if they're doing a shower routine or dressing routine, who's the one that's doing it? Is it staff? Because then again, you're blurring lines on who's allowed to be in the room when you're toileting and changing clothes and taking a shower.
Yeah. If it's a whole host of characters that are coming in and out of your shower and your changing room, where's the notion of privacy?
Yeah.
Where's the notion of privacy? Well, guys, yeah, go ahead.
Last question for you. Based on kind of your experience, so you were a BCBA first, and then kind of went into this field. That probably gives you some unique advantages and some unique perspectives. I imagine most people in this field don't come from a behavioral background. Maybe people that get the second certification that you mentioned that had more of the behavioral focus do. Can you speak to maybe the interplay between ABA and what you do, or how your BCBA background may provide you with some additional insight, or you currently find it useful in what you do?
Super useful because, right, we're behaviorists. We're looking at behaviors. Even if I'm not observing the behaviors that people are coming in with, there's still so much to work with in regard to behavior. And I think that each field of mental health, counseling, therapies all have their time and place. And for different individuals, they might need a more talk therapy approach that might be a little bit less in your face versus, right, like ABA, we like results. We're gonna push for those results.
Can you make it happen right now? Please do.
So we're gonna we're a little bit more nicely pushy, not pushy in a bad way, but nicely pushy with that. So there's some people where I've had them come and they've been like, you're like a last ditch effort. I've done talk therapy or dialectic behavior therapy for years and I don't see lasting results. Okay, well, maybe you need something that's more behavior based if we're talking about certain behaviors. And I tell clients that if we get to 20 sessions, like my private clients, not as much my DMH ones, because there's other factors at play, but my private clients, if we get to 20 sessions, we need to reevaluate where we are because we should be seeing progress. We should be seeing some point that we're looking at fading out of services, because if you're coming in and you're doing the work that we're having you do, we're seeing change quickly.
That's awesome. Yeah, I think in ABA we definitely do love to see results. Data for sure definitely drives us. Is there anything, and first of all, thank you for answering all of our questions. This is an area, like Mike and I said, we're super ignorant on, and we're really just interested to learn more. So thank you for answering all of our questions.
Of course.
Is there anything that you would like to say, just opening up the floor to you, any message, anything that you wanted to make sure that you bring to the listeners so that they hear?
I think, what we talked about earlier, just being a human, remembering other people are human, and, coming from a place of I want to understand and asking questions and getting the education, and also acknowledging that education is needed and can start so early on, and to sometimes, as much as we're talking about sexuality and things like that, taking that piece out of it when you're starting with younger learners, that this can be something you can set them up with foundational skills so that maybe they don't have to come see me when they're in their 20s.
Treat people like they're human. What an amazing yet simplistic response, and something that's so underutilized. Where on the private side, where can people find you? You said you do telehealth, so I imagine people can find you all over the country if they want. Or can you just speak to if somebody wants more information?
If you want to be found, where you might want to be found.
So they can look up the business name Empowered Center for Sexuality. I'm listed on there. I also have a Psychology Today profile that I can be found on, and that can send email or a phone call. So those are the big ones. I'm on Kink Aware Professionals. That can be another resource to use. Yeah.
Wow. All right.
Covered a lot of ground.
Thank you so much for your time. We hope to see you again at some point on ABA on Tap. Please do let us know if the show can ever do anything else for you. Again, can't thank you enough for your time on a Sunday afternoon. I'd like to do a little closing here for our tagline. So I'm going to say, educate yourself about sex, get comfortable, be human, and
always analyze responsibly.
Cheers.
Thank you so much.
Awesome.
Thanks so much.
Thank you.
Always analyze responsibly.
ABA on Tap is recorded live and unfiltered. We're done for today. You don't have to go home, but you can't stay here. See you next time.